我们首先有请执行单位中华民国对外贸易发展协会王希蒙秘书长上台致欢迎词。Now to welcome you all, ladies and gentlemen, please join me in welcoming Simon Wang, President and CEO of TAIDHA.
经济部国际贸易局李副局长。
Deputy Director Lee and speakers, distinguished speakers, ladies and gentlemen, good morning. If we want to choose top 3 well-known prime ministers in the UK, one of them, I believe, in your head will be Winston Churchill. He said that the most important asset in the country is to have healthy people. So health is closely related to the level of medical care. Whether the people in one country is healthy or not is closely related to the advancement and the level of medical care and medical technology. And the breakthrough we had before is because of the advancement of technologies. For example, X-ray invented in 1895, and this invention has helped greatly to the precision of diagnosis. And also antibiotics used starting from 1949 has helped greatly, especially to contagious diseases. And also other advances has also helped greatly to the advancement of medical technologies. It's because of the breakthrough of technologies helped the advances of medical care. And now with digitalization, we see, for example, AI, big data, and the telemedicine. So the development of these technologies have helped greatly the advancement of the medical care, and it's at the unprecedented scale. And indisputably, medicine plus technology is an important trend globally. Although the medicine and the technology, we are at the front line here in Taiwan for both technologies and the medicine. And here in Taiwan, we have talents. So the best students, most of them would choose to study medicine or electronics as their college majors. So in Taiwan, we have the development in these 2 areas. We really enjoy the advantages. However, sometimes people from different backgrounds cannot really communicate with each other because the logic behind the development of different industries are different. And we also have new industries, startups with new ideas. We see good development in these areas. And today, we are very honored to invite distinguished speakers from different areas. And we have Professor and Director of Vanderbilt Center of Quantitative Science, Vanderbilt University, Professor Shi Yu, and we see different collaborations among different academic institutions. And we also have one of the distinguished speakers is Chairman Chen from Taipei Medical University. I met him 3 times. The first time I met him, was the vice president, and second time I met him was president, and now this is the third time I meet him this year, and now he is the chairman. Probably next time he will be the minister. And we also have Mr. Wang Chin-Tang Wang, and also we have Mr. Jeff Liu. So we all know from Foxconn, and digital businesses are definitely very important part of Foxconn. And we also have a superintendent from Veteran University of Taichung. And this is just a morning session. And in the afternoon, we also have a well-known experts in the afternoon session. And they're going to share more on the AI and also the entire ecosystem. And after their speeches, we also have panel discussion chaired by Business Next Editor-in-Chief, Mr. Chen Wang, and they are going to have a panel discussion, and we can hear their conversation from our distinguished speakers. So today we are very honored to have this opportunity to listen to experts in different fields, and we look forward to listen to them. Thank you very much. Thank you. Thank you, President Wang from TAIDHA.
那接下来呢，我们有请主办单位经济部国际贸易局李冠志副局长上台致欢迎词。我们掌声欢迎副局长。Next, please join me in welcoming G.J. Lee, Deputy Director General, Bureau of Foreign Trade, MOEA Taiwan, for his remark. 掌声欢迎副局长。
Thank you. President Wang from TAIDHA, and President Wang mentioned many distinguished guests, speakers, and participants from all around the world. On behalf of the organizer, Bureau of Foreign Trade, I welcome you to attend Health Plus Conference 2023. Yesterday was the opening ceremony of Medical Taiwan. Actually, the development of medical technologies in Taiwan go hand in hand with our ICT development. And by combining the digitalization capability together with the medicine technology, we see great synergy between the two. So medicine development not only help us with our health, but also plays a very important role of the quality of life. And it can create values and create happiness. So for EA, we continue to work together with the industries and together with the academic institutions. We hope to upgrade our healthcare level and the medical level so that we can achieve precision medicine and the precision diagnosis. So we see continuous development of technologies, and we work together with TAIDHA and other organizations and to observe the latest trends and to obtain the latest business opportunities. And we attach great importance to securing these opportunities. For the past 3 years, the whole world was very much affected by COVID-19 pandemic. However, together we work together and we weather the storm, and we pass this difficult time of challenges. And we do hope that through this process, we can have a better understanding of the new normal after the COVID-19 pandemic, how we can provide precision diagnosis by using telemedicine technologies. And in Taiwan, we do hope that we are not only playing an important role of a research center and product manufacturing center, we can also be the hub of precision medicine and the healthcare and a hub that can help create a healthy and happy society. Once again, we thank you for your participation and we wish great success of this conference. Thank you.
Bring our distinguished guests and speakers to the stage for the group photo. 我们要再次有请外贸协会王希蒙秘书长。Let's welcome once again Simon Wang, President and CEO of TAIDHA. 掌声欢迎。美国范德堡大学时余终身讲座教授于时 Professor and Director of Vanderbilt Center for Quantitative Sciences, Vanderbilt University. 掌声欢迎。台北医学大学陈瑞杰董事长 Ray-Jade Chen, Chairman Board of Trustees, Taipei Medical University. 掌声欢迎。台湾数位健康产业发展协会王金堂副理事长，有请副理事长 Chin-Tang Wang, Vice Chairman of the Taiwan Digital Health Industry Development Association, 鸿海科技集团 B 事业群数位健康专案刘炳浩执行长 Jeff Liu, B Group Head of Digital Health Project Foxconn, 以及台中荣民总医院陈世安院长施安 Chen, Superintendent Veterans General Hospital, 台中。All right. Our speakers, would you please look at the camera in front of you? 我们首先请台上的所有的贵宾以及讲师呢，看向前方的镜头，一起合照。3, 2, 1。接下来第二张，有请副局长、秘书长带领大家一起比一个赞，好吗 ？Thumbs up, everybody. Yes. For further advancement in medical technology. 好，再一张哦。好，最后我们再看向我们前方摄影师的镜头，一样比赞。3, 2, 1。各位贵宾，我们再次给台上的讲师以及我们的贵宾长官一个热烈的掌声 ，Give them another big round of applause. You may return to your seats. 谢谢长官贵宾呢莅临今天的2023明日医疗趋势论坛的开幕仪式。We'd like to thank you once again for joining us for the opening ceremony for 2023 Health Plus Conference. 没错，就像是我们刚才副局长以及秘书长所提到的，我们今天在现场呢有多位都可以说是台湾乃至于全世界的这个医疗科技、医疗健康服务的重要推手啊。那接下来呢，我们就要请他们一一的发表专题演讲。We are very happy to be joined by experts from the medical community today who will be sharing their insights with us. 那接下来呢，我们要有请台北医学大学的陈瑞杰董事长哦。那就像是秘书长刚才所提到也介绍的，这个董事长呢之前也曾任台北医学大学附设医院的院长，所以在这个医院管理啦，以及这个医疗资讯方面都有非常丰富的经验。那同时呢，也推动台北医大呢要成为这个智慧医院，不遗余力啊。Ladies and gentlemen, our next speaker is on the stage, Professor Ray-Jade Chen, and he has a lot of experiences running hospitals and also trying to turn the Taipei Medical University Hospital into a smarter one. So now to talk about how to build a sustainable health ecosystem, please join me in welcoming Professor Chen. 接下来让我们掌声欢迎陈董事长。
谢谢。
Thank you. First of all, Professor Shi, President CEO Wang. So Professor Shi, it's difficult to speak after you. And also President Wang, Mr. Liu, Editor-in-Chief Wang. Good morning. So the topic today is just like what this slide suggests. Building a sustainable healthcare ecosystem, digital, integrated, precise, and sustainable. So I need to use the O pointer. Okay, now pointer is working. Okay, I'll present in Mandarin. So first of all, now we are not talking about disease. We're here to talk about health. So the topic I'm going to touch upon today, starting from the perspective of health. And when we talk about health, it's not in the context of hospitals. Now, it's when we talk about health, the context is actually in the community. So we're talking about the entire ecosystem. There are two important things. One is continuous management, continuous care. So we have to go beyond time, 24/7, 365 days. So continuous management, we cannot do that in hospital. So we have to go beyond the hospital. And also we have to be connected. So once we're connected, we can cross different spaces. So time and space, we need to connect them. Then after we do all these things, after we consume a lot of electricity and endanger the environment, then we have to put our focus back on the issue of sustainability. Just like Professor Shi mentioned, in Obamacare in 2011, health ID and health safety, the result was actually poor. It was true. It was poor. So how can we seize the opportunity? Just like Professor Shi mentioned, there are a lot of insights in science, and how do we manage them? And we now have a lot of evidence. How do we take good use of this evidence? And we have a lot of data. How can we capture them precisely? And next, now the concept has progressed from disease center to other focuses. Now, in Taiwan, we talk about 5 Rise medicine. So, but some people are still put their focus only on patients. Now we have people attendance today coming from different countries, and in different countries, in some countries, accessibility is a more important issue compared to affordability. So. In the past, we focused more on disease and the patients, but now we talk about health. And it's not only about patients, it's about all the population, everybody. So we have to put people at the center. It has to be person-centered. But there is, for one healthy person can be hospitalized tomorrow. So there is a thin difference between the two. So we have to use the real world data to predict when the disease is going to hit the human being. And I have been focusing on ESG, environment, society, and the governance. And for ESG, it is also people-centered. It's not really patient-centered or disease-centered. So if we say a patient needs immunotherapy, a lot of different treatments, a lot of expenses, and who is going to pay for that, that's one type of discussion. But then we talk about health, there are a lot of other topics to discuss. And this is the healthcare in Taiwan. For example, acute coronal heart disease, and a patient has this disease and hospitalized, and then be discharged and go home. But if we take this example, then it's still patient-centered, and we still talk about a lot about how to treat the patient and how to take care of the patient. But once the patient is discharged from the hospital, the focus should focus on the health, how to maintain the health. So the healthcare has to be close to home and be in the from using a home-based care and in a virtual approach. I believe you all have this experience that if you have a minor illness, it probably just to go to a small clinic. And if you have serious illness, you go to a bigger hospital. I use the data in 2011. And so this is a statement from Michael Porter. And when TSMC was celebrating its 20th anniversary, and this is the content he delivered in his speech. And he said that in Taiwan, we have good high coverage rate for our health care. And we have more than 20,000 clinics. And it's more than the number of our convenience stores. And we pay very little on medical expenses. But our healthcare is discrete, and the healthcare is fragmented. For example, one patient having a CT scan and in one hospital, and then he goes to another hospital. He might have to do another CT scan because of the information is not, or the system data is not connected. But now we already evolved, and the situation is no longer the case. Everything needs to be digitalized so that the data can be transferred. Now, I talk about innovation first because this is very important. Now, aging society and low birth rate is are important issues faced by Taiwan and by a lot of different countries. And digitalization is the most important thing. And just like Professor Shi mentioned, that there are a lot of data. And in the past, people were discussing dry leg everything is about data, how we can use the data, make them available, and how we can put that into the right place and make it in good use. And in the U.S., I think the situation is very similar to Taiwan. And in patients, when in the aging society, most of the patients will have multiple illnesses. So when we're treating the patients, are we treating diseases or are we treating aging? So this is another discussion. Now, we think we can not communicable medical diseases. This is where most of the expenses go to. So now, can we use some of the innovations or some devices so that these daily works, just like the theme today, and this is our normal, and can we use these tools to connect different pieces of information. So this is another example in e-tattoo, and this is one of the way we can get the information and transfer the information. And this is the case in UT Austin. And so this is another example. In the past 3 years, another mRNA vaccines were used, and now some of the medicines are used to treat chronic diseases. So every 6 months, and this medicine is being injected to some of the patients to lower their blood fat. And I believe that once the medicine is more popular, the patients can enjoy food as much as they can. But the most important thing is that they have to have this medicine injected, just like having a flu vaccine, so that they don't have to be restricted in terms of the food they like. And this is another example, CGM. Probably it can be sent to your home every 2 weeks, and you just have to put it on. So this is going to be more and more popular. And this is another example. So GLP-1 or SGLT2, and we know that some of the weight loss treatment is popular. And so is there such a wonderful medicine can prevent so many multiple diseases such as diabetes and multiple coronary heart diseases? And we can hear more discussions probably in the afternoon. And this has been a hot topic in the medical field in the U.S. as well. And so for chronic diseases, as the medicine technology advances, and if we also use the telecommunication and also the telemedicine. And we can really treat chronic disease and just like to make it our daily normal. So the reason why I mentioned different diseases. For example, some children are having ADD, and we have also heard of these digital therapeutics. And for children with ADD, they can be treated by playing video games, and this is one of the innovative treatment. And this is much better than having these children taking medications. So I think innovation is very important. In the past, in 2015. And people were already talking about the precision medicine, and now hospital services has been decentralized as well. And I mentioned quite a lot that a lot of young doctors are saying that they are not respected by their patients. And I heard the complaints from young doctors, and I said, why should the patients respect you? And the patients are, some of them probably are more knowledgeable than you are. And now because the knowledge is being more democratic. So people can really enjoy the benefit brought by these knowledges. And so we have a lot of different conditions and compared to the past. ChatGPT and Professor Shi just mentioned that, so I just passed that. So here, time to edit, for example, one article, if we ask the machine to translate for us, and once it's translated, then we can have expert to review it. And in the past, in 2015, and the time is 3.5 seconds per word. And now we know that machine translation can replace human translation. So in the future, if you want to read the books written in the language that is not your native language, you can use this machine translation easily and have a good understanding of the knowledge. So in the past, information shortage was a problem, but now we believe that this can be resolved by the advancement of technology. So how do we do it? And Professor Shi also mentioned about the clinical trials, and I believe that many of the information from the clinical trial can be put into good use. And the problem is how we use them. So where the problem is, and for example, like ChatGPT, and sometimes it goes wrong. But the most important thing is that at least you have an overall understanding of the entire article, and then you can edit it and to improve it. Another important thing is that. With these technologies, risk can be controlled. Maybe once we finish one article, and this artificial intelligence, these programs can tell you where the risks are. In the afternoon, I'm going to visit one hospital and to review. And probably I don't have to go to see these hospitals anymore. And these review can be done by ChatGPT or other technologies. And important thing is that we have to have this concept, we have to have this awareness of ESG. And we also heard from some experts, how can we make medical services greener? And so one thing very important that Scope 1, direct emission, we want to lower carbon emission in the hospital. And the Scope 2 is indirect emissions because the electricity is generated by the power plants. And so this is the indirect emission. And this is something we can do here as well. And in Taiwan, we already hear from the government about their plan to reduce carbon emission in 2050. And for if it's medical related field, because in Taiwan we export most of our products overseas, but for domestic demand, and this ESG, this is a universal issue, and we have to make investment to be able to see the results. People from different fields, they sometimes people are affected unevenly, and there are some risks. For example, some people would lose their job because of the new advances, and maybe something become. There are things that are becoming more expensive, but there are challenges and opportunities. So in the hospital and in my hospital, we are now reviewing our carbon emission. We have carbon inventory, and we also look at different approaches to inject medicine, whether it's going to be an approach of inhalation or injection IV. So these are different approaches, but another important approach is telemedicine, and I'm going to mention that later on. And in Oregon, we already know that from the approaches taken by other hospitals, and some of the carbon emission can be halved. So how to create a sustainable digital health system, and we mentioned about we have to find the most suitable program, O2O, and end-to-end. After all, we have patients at one end, doctors at the other end, and now if the patients and doctors are facing each other face to face, and then if we see these opportunities and we know what the trends are, and we believe that we can find the right way. So that was my presentation. So we have to innovate, and we have to put the content in a digital form, and we have to think about the sustainability. Thank you.
Chen for his very insightful talk. Thank you. 那接下来呢，我们就接续董事长的这个演讲哦。接着呢，我们要有请台湾数位健康产业发展协会的王清堂副理事长来跟我们谈谈如何透过数位医疗服务，如何透过远距医疗服务呢，来让这个不管在哪边都可以享有这个零时差的医疗服务。Ladies and gentlemen, our next speaker is Chin-Tang Wang, Vice Chairman of the Taiwan Digital Health Industry Development Association, and he's going to talk about how to ensure that we have healthcare services for everyone, anytime, anywhere through digital services. 我们掌声欢迎副理事长。
谢谢。
Good morning. Our host asked me to talk about medical care for anyone, anywhere. So one of it's medicine. So the goal of our association for the past 2 years is medical services for everyone, everywhere. So I want to talk a little about what we're doing right now. So for the past 2 years, the government and a lot of researchers have actually conducted a lot of regulatory talks and seminars, and they have set a lot of policies and rules for telemedicine or telehealth. And that's what I'm going to talk about today. So today is about digital health. And the source of digital health is Industrial Revolution. 30 years ago, we had our first internet. And the appearance of internet has a great impact in all fields and all industries, and of course, healthcare. And it's an ongoing progress. And the first industrial revolution and the second revolution have changed the world, but none of them compares to the appearance of the internet. The fourth industrial revolution would involve the innovation of metaverse. And that's what we're going to have to talk about or pay attention to when it comes to telehealth or digital health. So in the past 3 years, we have COVID-19 that actually hit the world and caused a lot of problem. And we have a lot of technological applications. And technology has been booming throughout the 3 years pandemic period. And then we have telehealth, telemedicine, and the application and the investment have all reached new high due to COVID-19. So the use of technology has progressed really quickly. As for the medical expenses, how does it influence digital health? In 2019, there is a future medical report that has 3 trends that we must pay attention to. The first is that these 2018, we have 4.5 billion people that needs medical care. And now we're going to grow to 6.8 billion people. So we have a shortage in our resources, and the form of medical need is different. In 2018, at the time, we have 10.6 trillion medical expenses. And then in 2030, it's predicted to reach $15 trillion. So the semiconductor, the overall value is $500 billion. So as we can see, the medical expenses is really high. So about precision diagnosis and digital health and prevention medicine, it's about 7% of the medical expenses. Overall, most of the medical expenses is about medicine and of the traditional hospital expenses. So we can see in 2030, the precision diagnosis, digital health, or prevention medicine is going to grow in the medical expenses. It's because due to the growth of population and the aging society, we have more chronic diseases. So we can see that the traditional medicines are not working as well as before. So what we're trying to do is that we have to reallocate our resources. So in 2030, we can see that medical expenses per person will decrease. And we can see that more people are actually using precision diagnosis and digital health and digital medicine. So the government really should adjust the policies and see how you can reallocate the resources for the medical insurance. As for the Taiwan medical insurance in 2015 to 2019, we can see a difference. The medical expenses is still mainly in clinics and hospitals. It's about 80% are from these traditional sources. In 2019, we can see the medical expense has grown, and a lot of from chronic diseases and long-term care facilities, they've all actually increased in the ratio of our medical expenses. So we must really take a look at this trend. So about precision diagnosis or digital expenses, we can see that it has not grown by much. So in the future, the government or our health insurance should actually focus more on digital health or telehealth. And the application and the technology still needs development and advancement as to transform the present conditions of our medical expenses and structure. So our association has 3 different branches. One is digital health, one is digital medicine, and one is digital care. So through these 3 different kind of approaches, hopefully would actually promote the advances of the entire field or industry. So in the past, it is medical care is a very personalized treatment. And then people started going to hospitals. It's like a mass-produced place of medical treatment that they deal out these kind of diagnoses. So it's a different transformation. But in the future, we can see that we're going in the opposite direction. We're going to decentralize and try to refocus on human. So I think it is because of the advance of technology we were able to center on human needs. So we have a lot of new technologies, for example, bio buttons that can collect some of the data from your body. So we have apps on your phones, use microphones to actually collect data. And then we have a digital stethoscope from Taiwan. Now, this stethoscope will allow people or doctors to actually diagnose digitally. So these telehealth, we have a rules of medical diagnosis and treatment by telecommunication. We had some draft amendments due to the pandemic. So we spent like a year or 2 on amending the draft. So last year, in November, we have these amended drafts. So we had 5 groups. Now we have 10 groups that can be applied to telecommunication. As for the categories, they can actually diagnose, give prescriptions, and issue long-term care for disabled. So last year in November, they have actually wished to implement these rules this February. But because the pandemic is about to be over, we are trying to actually reevaluate these rules to see if it fits the present condition. So telehealth, is it something that we are pressed into, or is something that is actually necessary and efficient? So right now, people think we use telecommunication for our medical care is because we're pressed into it. Doctors wish patients to go to them in person. But right now, we see a lot of medical systems are in urban areas. And a lot of patients, actually, they have a hard time going from their homes to the hospitals or clinics, which is why we're trying to figure out a way to actually cater to the needs of these more disabled patients. As for the chronic disease patients, they are also adopted into the draft this time. Maybe they will provide better medical services for them. So, which is why we are actually looking into the draft to see if we can provide better services for these groups. So through telecommunication and telehealth, we also had some surveys. So before the pandemic, so 90% of the people would go to the hospital and make appointments in person before the pandemic. But right now, 36 of the patients are more willing to visit doctors online. So that is the statistics we got from 2010. So 92% of the people are willing to visit doctors online, to consult doctors, or do telecommunication for their diagnosis. So these telehealth, after the pandemic, are they still necessary? Are they still needed, or are they still valued? As high as 70% of the patients are willing to visit doctors online. So a lot of people had no experience in the area, but last year, for people who tested positive for COVID-19, they are able to actually visit doctors online. So we have 3 million patients that have already used the service, and they have actually understood how convenient it is for them. So last but not least, so for the Taiwan Digital Health Industry Development Association, we call on researchers and experts, professionals. In 2021, we founded the association. We want to change the structure of the present medical industry. So we want preventative protection, and we want to actually improve preventive medicine through technology and actually promote exchanges, cross-border exchanges, so to take a peek into new possibilities and new potentials. So what we're trying to do is that we're promoting ICT and medical industries fusion. So we would like the government to take a look into the policies for the startups. We need a rule or regulation to regulate the entire new condition. So that is one of the things that we are looking into right now, and we are reaching out to other facilities and institutions around the world as well. So we have a lot of members. They are domestic entrepreneurs and healthcare industry, the electronics industry, and the smart medical industry, the insurance industry, and the finance industry. Hopefully, we will incorporate their help into our health insurance system so they'll be able to pay or participate in the system in different ways possible. Now, we have hosted a lot of activities. We have these key trend forums. We have just finished hosting this event. And then in August, we have another seminar on digital health. We asked the academic, the government, and the academia to participate in the discussions with us. So we hope all the corporations and guests to take interest with us today. Thank you.
我们下一场演讲比较聚焦在这个科技以及设计面我们看看如何透过跨界整合呢，让这样的数位，让这样的精准医疗服务从院内走向院外，走向社区，走向我们每一个人的家里Ladies and gentlemen, our next speaker is Jeff Liu, B Group Head of Digital Health Project from Foxconn. He's going to talk about how to make digital healthcare transformation possible from hospital to home care. 让我们掌声欢迎鸿海科技集团数位健康专案刘秉浩执行长。
好，谢谢。
Thank you. President Wang, Professor Shi, Chairman Chen, Vice President Wang, Editor-in-Chief Wang, distinguished guests, ladies and gentlemen, good morning. I'm Jeff Liu, B Group Head of Digital Health Project, Foxconn. I feel very stressful when I have to speak after so many distinguished speakers. So I'm going to focus on ICT and to discuss how we can realize bio ICT, and I'm going to bring you some business cases. So this is my topic: integration times ecosystem, enabling digital health transformation from hospital to home care. First of all, I have to advertise for my company, Foxconn. So after Chairman Liu took office, we have this 3+3 strategy. So 3 new industries and plus 3 new technologies. So this is our strategy. So for 3 industries, you are very familiar with our deployment of EV and also digital health and robotics. And so digital health will be my focus today. There are also fields, for example, AI applications, semiconductor application, and this is also some of the new technologies that being developed by our research institutes. Now, for Foxconn, when we're defining 3 trends in Taiwan, which is the most important thing for my presentation today, for digital health, the most important trend is cross-disciplinary integration and to form new ecosystem. Digital health is an extension of medical care and or healthcare. So this is going to be a gigantic ecosystem. Last year, we worked together with multiple enterprises and to form HiMed, Harmony in Medical and Technology. And we're also going to focus, and in the past, people focused in hospital and the healthcare in the hospital, but now we've put the patients at the center. We have the patient center concept. And thirdly, the third trend is that we're going to use data as a data-oriented digital technology platform. And this is the solution that I'm going to explain further. So last year, in December 1st, and we established HiMed, Harmony in Medical and Technology. So what is special about this consortium is that we combine different association institutions, not only in the ICT industries, but also in some of the religions group and also some of the social welfare service providing groups. So we do hope that for this program, we can really contribute to the society. And so we have this new model, new ecosystem, new data, and a new territory. So these are the 4 principles in HiMed. So first of all, in the hospital, we want to put patients at the center and use the technology as the bridge. And so for Chairman Chen, he is actually being at the even further and to now we are one step maybe behind Chairman Chen, but now for traditional medicine, and the traditional medicine focus on the treatment in the hospital, but after the patients are discharged from the hospital, it's difficult to connect the information, what happened to the patient after they're discharged from the hospital. So now we're going to use the new technology to connect the two. So I'm going to explain to you the technologies we're going to use. And one thing important is that why technology is very important, because that is the gateway to connect the patients and the doctors. So at the we have a series of co-doctors, and these are different terminals. And these devices, can capture vital signs from of the patient, starting from the heartbeat, and for example, the body temperature, body and fat, and all these vital signs critical to the diagnosis of chronic diseases. We can obtain this information, and in the field of B2G and also in the context of home care, and we have different approaches, different hardwares and different designs in different healthcare context. And for example, some of the information needs to be obtained 24 hours a day. And not only we obtain vital signs, we also sometimes have to obtain images and other information. So these are the information we can get using the terminals and the technology terminals. And we have to have even more. And we have also to communicate with the patients using these terminals to communicate with the patients. So traditionally in the hospital, the information can be collected in the hospital for sure, but how can we communicate with the patients discharged from the hospital? They are already out of the hospital. So a very important thing is that we have to have a cloud platform. So every the healthcare information and can be taken care of outside of the hospital, and once they are taken care of, they can be transmitted to the hospitals, and there is one unit in the hospital to process the information coming from the outside, and after this information being analyzed, and then it can be used, it can be analyzed and put into good use. Now, in the past, we only have the information about the patients and the data about the diseases, but now we also have the data related to vital signs and for other medical information, so that it can be used for predictive medicine, for example. So the platform, the core of this platform is very important. So I can give you one simple example. Now we're working together with the Changkang University, and we already established a smart medicine center. How did we build up this platform together? First of all, we have these 4 layers. And the first one is the basic layer, and we also have for the foundation, we want to make sure the safety of all the data. So the examples we use, and so we focus on the for example, ISO standards, and whether the information being transferred and transmitted, and whether they can conform to some of the standards to ensure the safety of the data. And secondly, in the computing layer, there are different algorithms, and all the algorithm is used to support the models on the upper layer. So for the upper layer, different models are used to solve different problems, each individual issues. And once we have these models on the top layer, we have this smart medical application platform. So for example, chronic diseases. And for this system, and it has different departments, different disciplinaries, and it can use different applications and to form a working station for a doctor. And so for different disciplines, for different diseases, and we can combine different models and for example, one application on ECG or diabetes or metabolics department and or the neuron department, and we have different settings. And the advantage of that is that very quickly, and because for each department they have different characteristics, and very quickly by combining different models, we can form the solution for each department, the most suitable solution for that. And for AI model training, and I think all the data and all the hospitals are very cautious of how these information or how these data is being used. So this is how we do it, and these are the hospitals we work together and how we train their AI, train their data. And for example, Chang'an Hospital and for Tongzhonghe Hospital in the middle of Taiwan, and also Tzu Hospital. So we established the Smart Medicine Center for each hospitals, and for all the models we saw before, and we pack and use these models and put that into each hospitals and use their data to train. And after their data is being trained, and they can put it back to the platform we have, and then I can use that to update my AI model. So this is the approach we use. And first of all, we can make sure that the patient's privacy is being protected, and the information will not be disclosed, and we can develop the AI models with each hospital's characteristics. So from the hospitals all the way to communities, and also the management and the services provided to remote areas, and we can have a wide use applications and to provide services to various areas. So how do we have the real business case? So first is the digital health family. Now for smart homes, the idea and the applications of smart homes is quite widespread. And in this business model, we look at some of the target patients, maybe 90% of the patients, and actually 90% of the management of the disease, management of the patients are conducted outside of the hospitals. So we can put the information in the cloud platform, and we can communicate different information through this platform. So this is how we connect inside and outside of the hospitals. And if we really want to make it a business case, how do we charge? How is this being accepted? So that is why we work together with telcos, and we can make it a infrastructure under the umbrella of smart home. So this is how we can really deploy the services inside each household. We also work together with the Tzu. Tzu is a very interesting group, because Tzu has hospitals and they invested heavily on providing medical services. And Tzu group is also is a religious group, but it has services covering 93% of the remote areas in Taiwan. So we work together with Tzu, and we deploy the solution in 93% of the remote areas in Taiwan. We also have this workshop in north, middle, and the south of Taiwan. And there are a lot of volunteers from Tzu. Most of them are medical professionals. And we have this workshop together with them, and to let them know how they can provide medical services. And also, we work together with the different groups, because a lot of people, for some people would also go to Saudi Arabia and to as a pilgrim. So we can let them have this wearable, and to collect the different medical information, so that we can monitor the health condition. And so this is how we can support the health and the safety of people when there are large gatherings. And we see that how we can collect the vital signs of people when they're outside of the hospital. And we work together with Dr. Huang from Linkou Chang'an Hospital, and he is the leader of the eye care and department. And he realized that for the images captured by fundoscope, and after these images being analyzed, they can be used to for diagnosis of multiple diseases. So we work together with Dr. Huang. For Chang'eng Medical Group, now they have more than 5 million records. So we can analyze these images collected by fundoscope, and that we can analyze these images and to use AI to compute and to predict other diseases from happening. And for digital health, we can really, by using the digital health, we can provide these medical services from hospital to outside of the hospital. Thank you.
Much to Jeff for your talk. 我们要再次感谢今天上午有4位讲师，包括了石教授、陈董事长、王副理事长以及刘执行长呢，跟我们分享利用 AI 或者是最新的科技，如何让我们可以提供更好、更加精准的医疗服务。当然，进而呢，我们是要打造一个持续不断的创新、以人为本、那永续的健康照护体系。Thank you once again to our 4 speakers this morning that have shared with us how to enable us to provide better services through the latest technologies. 那接下来呢，我们最后的这个焦点对谈的时间，要有请我们刚才的讲师以及我们的主持人到台上来。首先呢，我们欢迎主持人数位时代王志仁总编辑。For the panel discussion, let's firstly welcome our moderator John Wang, editor-in-chief, Business Next. 有请。And our 4 speakers this morning, 我们今天上午的4位讲师，让我们再次有请美国范德堡大学的石宇终身讲座教授。Once again, let's welcome Professor Yu Xu from Vanderbilt University. 掌声欢迎。台北医学大学陈瑞杰董事长 Ray-Jade Chen, Chairman of Taipei Medical University. 掌声欢迎。台湾数位健康产业发展协会王清堂副理事长 Chin-Tang Wang, Vice Chairman of Taiwan Digital Health Industry Development Association. 掌声欢迎。以及鸿海科技集团 B 事业群数位健康专案刘炳浩执行长 and Jeff Liu, B Group Head of Digital Health Project Foxconn. 有请。那我们有请主持人以及4位与谈贵宾就座。Please take your seats on the stage. 时间交给执行长，时间交给总编辑。有请。谢谢。
Honorable guests and our speakers. Okay, Professor Shi, I know that we'll give you enough time to answer the questions today, okay? So we talk about digital health. So before we propose our questions, in the past 3 years, the pandemic has promoted the transformation of digital health. That affected a lot of long-term care facilities and the medical industry. So it's about then $200 billion US dollars. So every year there's a 16% of growth. So KPMG in 2020 in digital health, through 3 years of pandemic periods, we have 67% of the care facility has actually reached the second phase of transformation. So 2025 will become a super aging society. So we have 25% of the population that is over 65 years old. So Taiwan and globally, this is what we're facing today. These are our challenges. So about health and digital care is most related is the pandemic. So what is the drive? CEO, CFO, or COVID-19? Okay, the answer is COVID-19. But as COVID-19 started to abate, we will be facing new viruses in the future, though we do not know when, but the threat is there. So what's our next step? How can we face these threats in the future? What are the preparations that we must do? Do we have these implements or applications that we should adopt? So please, Professor Shi.
中文还是讲英文 ？Everything is OK。OK， 他们可以翻译吗？
可以。
OK， 好。3年的疫情。
For 3 years, pandemic changed the world and the lifestyle.
我们必须要 respond very quick.
We must respond quickly from government to hospital. That's number one. Number two, we must not only respond quickly, we must be very precisely predict what's the next.
I'll give you 2 examples. 我一直到今天，我们每个礼拜还会 generate.
We generate a prediction model for our hospitals. In the next 7 days, or the next 14 days, or the next 30 days, we will predict how many COVID-19 patients will come to the hospital, including who will enter ICU, who will use the ventilation. So we must use these algorithms smartly. Well, do you know that your model has a 99.8% of accuracy? So we must use these predictions to actually calculate how many people can actually take a break or take a holiday. So I proposed in the future, we must have these quick testing sets. In the beginning of these pandemic, when we're opening up our communities, we're getting people back to their jobs and schools, we must have these quick testing sets. So what's the next? We need to learn to respond very well through these predictions. And then must be decentralized. Through clinical evaluation, we learned that the top medical journal published a clinical trial. We have a lot of AI devices. We need these assessments to figure out which AI is most apt to satisfy our needs. So these critical assessments through these 5,000 patients, none of these participated in the hospital's evaluation. That is called a complete decentralized. From the shipment prescription or from getting these medicines, all these data does not go through an actual hospital. Then we have these data 24/7, then we assess the treatment throughout the data. I'm going to ask Chairman Chen. For COVID-19, I think in the clinical area, we have learned a lot through the pandemic. And one of the most important things that Taiwan is very different from the United States or other countries in the world. We have a geopolitical attention. COVID-19 is a medical crisis. So we have a lot of typhoons, earthquakes, natural disasters. We have 91 earthquakes and thousands of people died in this earthquake. And we have Bashan Amusement Park. The explosion also killed hundreds of people. So a crisis will kill more than 10,000 people in Taiwan. So what can we do? Will the hospitals simply just shut down? How can we rise up to the challenge? So how to predict and how huge or how large the model would be through these AI models. Second, we must talk about if we need a hospital for these disasters, for these foreigners, so how can we react and combine with the actual situation and respond immediately? That is what all countries must do around the world. We cannot actually implement different mechanisms according to different situations. We must incorporate these systems. So these emergency rooms, how can it evolve due to the impact of these pandemic? We must have a flexible ICU. What are the kind of patients? They don't need to go to to go to the clinics or hospitals. They can just stay at home and use telehealth. This is what we're trying to do. We must start here and go back and revisit to what we have not done well and then rise up to the challenges in the future. Taiwan might be lacking in medicine. So what might actually make this whole situation deteriorate? And then we are facing that our birth rate is actually really, really low at the moment. A lot of clinics are closed because we do not have newborns. So how can we actually deal with this situation? What can the government do? Are we still discussing should we pay for our health care when all of the hospitals are actually closing down? So because of COVID-19, it is just a trigger. Should we actually learn from COVID-19 and extend the solutions to other crises so that we can actually grow and will be able to handle the next challenge that comes our way? Thank you. So about the low birth rate, we'll be talking about this in the next round. So you talked about hospitals and clinics. They need a contingency plan because the patients or the people will face different kind of crises in the future. So we must compare all these different kind of models or predictions so as to be able to be prepared for these crises. So I would like to ask Jeff Liu later. So Chairman Wang, what do you think? So the next crisis or the next pandemic, I think what's important is the preparations that we must make. Of course, one of them is regulations and rules that need to be very comprehensive. Right now, the pandemic is actually backing down, and then we really need to actually have a better regulation or rules. And then about the insurance, we need more commercial insurances or other kind of insurances or digital health insurances maybe to actually accommodate the present situation or the future risks. And of course, the medical energy in Taiwan needs to be actually calculated and designed to face new challenges. Today, we talked about telemedicine and telehealth, a lot of different models. How can people, visit doctors, make appointments online? This is a very pressing matter. Thank you. So you talked about regulations and policies, and then we talked about prices and about collecting data. We'll talk about this in the second round. Well, we're targeting COVID-19 in the past few years, but in the future, if it becomes a norm and we are facing, these viruses, powerful viruses, what should we do? That's what we've been doing, is that because of COVID-19, a lot of activities are shut down. So the government, they actually promoted Vision 2030. They want to build a smart city, and one of the key element is health. So we were cooperating with the government. We want to control the situation, but health is only one key part. So we need transportation, we need communication, we need the demographics, we need to have a lot of data to actually create a structure that has the maximum effect. So about incorporating data and sharing data, I think it is very important. So what we're building up right now is on the structure of the smart city. It's just one link within the smart city. So in the future, I think the application of data would be maturing. In the future, there will be cross-industry or cross-border cooperations, and the government should really work with other industries or other government for a better structure. Thank you. I would like to ask Professor Shi, you talked about the genome marking, and you talked about the biobank in the UK. You have markers, and these genome markers can be applied in future researches and applications. So we have medical energy, and then we have a strong biodata bank. So how can we actually use this and make more progress? I think the United States or the UK, I think the whole genome sequencing, not target sequencing, it is a whole genome sequencing either in the United States or in the UK is what we must learn from. Because in Taiwan, we do not have a big cohort like they have in the UK or in the US. The US really supported genome sequencing. Now our university, we have a report, we have a top 5 medical school. Though not many have heard Vanderbilt University, but we are the top 5 medical university in the United States. Now we have a 250,000 genome sequencing. The entire UK has only actually 500,000 genome sequencing. And we, as one university, we have 250,000 genome sequencing. We have a for-profit company. It's 100% owned by our university. None of the profit is going to go to a private source. The entire profit goes into a whole genome research program. So this is our BioView research project. It's actually funded by these profit. So we did not have 250,000 genome sequencing. And then we worked with these pharmaceutical companies, and then we worked with these companies and corporations with the laboratories and kits, and then all these data were collected. And then we worked with Illumina. Now, these Illumina, they paid the bill for the laboratories and for the partners. So what we do, we just do the research. So for the data,
I couldn't agree more of how we have to connect the data. So patients, we let the patients to wear smart watches, and that we put everything information digitalization, including the air quality, the air around the patients. And we need to invest. It's not about money. It's also about the right time. And we have to collect the information at the right time so that because the information changes. So we have to invest for a long time. We have to follow all the data around this patient so that we can build reliable, predictable models. Thank you. Thank you very much, Professor Shi. The next question is for Chairman Chen from Taipei Medical University. So in terms of innovation, medical innovation, and certainly there has to be incentives, and this is what the Taipei Medical University has been working very hard. But now in Taiwan, we have low birth rate, and this problem is going to be more and more serious. And you also mentioned that it's possible that in the future we're going to have less wards and less outpatient sessions because of the low birth rate. And how do we do a good job in terms of innovation when we face low birth rate? Yes, that's a very good question. How do we train a talent? Because we have the best students enrolled in our university, and we have to deliver a talent. In the past, people are talking a lot about that the students trained by the universities are not really cannot really satisfy the needs by enterprise or by the industry. So how do we train our students? And so that we adjusted our approach, and then we're criticized that we're too narrow-minded, and we didn't really provide a cross-disciplinary education. But now, because for our university, we also have hospitals, and so we have the school is more like a production factory, and so I also have the store line, and front line which is our hospital. So our students, they need to learn a lot of different disciplinaries, so including law, including the social sciences. So the students also, on top of the medical training, they also have to learn a lot of different disciplinaries. And once they complete their trainings, of course, we welcome people from different medical trainings, not only from our own university. And then once we have the talents join our hospital, we have to retain them. Retention is also very important. And on top of having these employees being qualified, and they have to we have to monitor their performance. For example, a nurse, and when the nurse is taking care of patients, and so we have to have this data that, okay, so after a period of time, how many, what kind of patients have this nurse taken care of, and what are the performances. So we have to be able to collect the information, follow the information, and have this trend. So not we don't want the employees or medical professionals, they are disconnected with the real trend, and we want to make sure that all the talents can really make their contribution. So from us, we are an education group, and we also have the hospital. So in Taiwan, at least at the board of direction, this is what we want to focus on, to really take care of the issues of low birth rate and the aging society. And so the next question is about the digital technology and its combination with the medicine. Because when it comes to medicine, who is going to pay for the bill? And if there are innovations, who is going to pay for the bill? So now, if we want to obtain vital signs, of course, it can be resolved by technologies. But for expenses, who is going to take care of the expenses? And because at the hospitals, hospitals are not the ones who are paying for the bill. And so what are the challenges do we face here, and how we can have a better development facing this challenge? Taiwan has the best healthcare system in the world. In Taiwan, we also have the best ICT industry in the world. And for these two fields, both of them are professional fields. Very often we hear from leaders in the industry or our members, we hear their voices that for these two fields, it's actually difficult for these two fields to communicate with each other. They are doing their part, and it just needs time and efforts. So we don't really worry about that. What we worry more is about regulations. For innovations, no matter it's telemedicine or medical devices. There are a lot of different things involved, platforms, hardware and software, and new innovative business models. All these models need to be backed by regulations. So the biggest challenge we have is actually regulations. How the regulations can cover and also the payments. How can we make sure that the data can be released conforming to the law and to be put into the right place and being used in a good way? Thank you. The next question is for Mr. Liu from Foxconn. So what is your comment on the AI applications on medical field? So after the ChatGPT is launched, people are even more enthusiastic about AI. From the aspect of AI and BI, they have been in the industry for a long time, but it's just different applications in different industries. For medical industry is relatively closed because it is an industry focuses a lot on stability and no accidents. And now this year we see like explosion of AI technologies and the application of AI technologies. We're optimistic about the development because we see how people actually have higher demand. And also the government is focusing more on how to open up and how to accelerate the formation of regulations. And we see how different department agencies, for example, the welfare and department, health and welfare department and the Ministry of Economic Affairs and the different government agencies are working together because we need to see a safe application of AI technology. We already have this SOP, and for us, we have ChatGPT and AI-related committee, and to ensure the safe use of AI and from different perspectives, for example, the regulations or marketing. This is something we are already discussing, and we also have our own guidelines how we can use AI by not revealing any sensitive information. I think this is something everybody is doing, something and people are all working very hard on. Thank you. We're starting from ChatGPT, and there are also other generative AI, and we believe that they are AI development, other development as well. Now, because of the interest of time, can we please invite all the panelists to comment on because when we talk about health, we all want to live healthily and happy. And now the average life expectancy in Taiwan is about 80 years old. And we all want to live healthily and happily. And what can we do to achieve that goal? More data. When you have more high-quality data, then that is the answer. Thank you. Chairman Chen. Just like we mentioned before, data is a good thing in Taiwan, but there are still restrictions, regulatory restrictions, so we have to open up. And also for the national health insurance direction, where it is going. I think for telemedicine, please, we do look forward to further development of telemedicine, and we don't want to see telemedicine to stop because of the end of the pandemic. And thirdly, a lot of the technologies are too complicated. So these, because they're too complicated, so that they cannot really be deployed and or enter our daily life. And once if that is the case, we cannot really have an ecosystem. So simplicity is the key, and this is the direction we should go. And in the hospitals, a lot of things are very complicated, but we have to really streamline it and to make it simple. I think this is a very important direction we should go. Yes. Maybe we need a Steve Jobs in the medical field so that complicated things can be turned into simple ones. Thank you. Yes. Now in Taiwan, we are going to enter the ultra-aging society. I think there are many things we can do. Number one, we have to use more applications, new technologies on top of AI. We also have other technologies that can be put into use in the medical care field. And the direction we should go is preventive medicine. And just like we see that the medical expenses are going up around the world, and Taiwan is no exception. And we have to go towards the direction of preventive medicine. And digital health is one of the approach we use, and this concept is cannot only be used within the hospital, but in the context of home, in the community. So the healthcare is being done not in a hospital, but in home and community, and also regulations, and this is something that we can really work on, and the government and the associations and industry associations can work together and to develop the regulations. Mr. Liu, please. Yes, we are using resources to build new business models or a new way of healthcare, and combining with the data provided by the government, or to work together with the government to comply to the new policies, so that we can form a new service model. And I can give you one simple example. And we work together with Tzu and University. We built the service. Because for the Tzu University, it provides courses for people and elderly people, and we deploy our services combining these courses so that the elderly people can also enjoy our services. Thank you. Thank you very much for the insights brought by four distinguished panelists. Yes, we do need to work more on the regulations, and we need to innovate. Once again, thank you very much.
舞台中间，我们再拍一张照片，好不好 ？And thank you once again to our panel for giving us such a wonderful discussion。再次谢谢我们台上的贵宾哦。那我们今天的上午场呢，就到这边告一段落。再次谢谢我们所有讲师精彩的分享，也谢谢大家的参与。